Now, let's talk about among other things here, this situation in Victoria and whether we have to move to mandatory testing or not. There are thousands of people who are just refusing to take the tests. Now, Liz Storer, what I am most fascinated about here is that we've got the ability to have incredibly insightful information about this pandemic at the moment, like literally this many tests, this many positives, these were the places where, these are the ones that we're still investigating, right? Why don't they tell us where are the people, where is the concentration of the people refusing to give a test? If so, why so? Why do we not have a little bit more information about whether it is, you know, a sort of strain of anti-vaxxers who somehow think that, you know, a computer chip is on the end of the swizzle stick and when it goes into your nose, they're secretly putting it in your brain, you know, or is it, you know, people who are just sort of too much machismo and just that they won't take it up the nose for anyone, you know. I mean, I don't know what it is, right? But we're not getting information about this, and I think that when this is the real public health risk, right? Because as we've shown, they tested 21,000 people yesterday. They got about 60 people who with COVID. Okay, that's about 0.4% or whatever I said earlier in the show. Okay, so that's being dealt with, but we need to know who and why they are refusing to get tested. Don't you think, Liz?
Look, that would be interesting info, but I honestly believe this is just a clear indication that Aussies has had enough of the hysteria. They know we have 8,500 cases, have had 8,500 cases in total here in Australia with only 104 deaths. They know a lot of the hysteria is now bull, and a lot of them getting pulled over, asked to be tested. They don't want to go into ISO. They know that, well, I feel fine, so even if I'm positive, who cares? I'm fine. They don't want to not get to go to work anymore. People have finally got to return in dribs and drabs. They're counting that cost and just going, look, with the death rate what it is, all this hysteria going on, I don't care whether I do or don't have it. And I think it's mostly people, this is where it would be interesting to know who they are. I think it's mostly people who probably don't have people who fit the description of those who are vulnerable to this thing in terms of being a fatality. They don't have people who fit that description in their lives. So it's not as real for them. It's not as personal for them. Yeah,
I mean, again, here are the stats, right, James? 21,597 people, 97 rather, were tested yesterday, of which 67 were positive. That's 0.3 of all of the people that were tested yesterday, all right? Of the 543 active cases, just 4% are currently those in hospital, all right? So I think the actual, are you going to get crook or not, is being dealt with so aggressively, but the non-compliance really is an issue here, because if it's a bunch of people just putting the middle finger up, well then, okay, probably going to have to change a rule to make them do it. But if it's, you know, a whole bunch of conspiracy theories or something else, then we don't change the law. Those people are just lunatics. What do you think?
Yeah, look, it's getting that challenge here between, you know, I'm part of the freedom faction of my party, where I really don't like the government telling me what I can and cannot do. But when you're in a pretty serious health pandemic, and you've got people refusing to take the test, especially in Victoria, you start to go, hang on here. Why are you refusing to do it? But also, what's the government doing? And the real story out of Victoria, yes, we're talking about you know, testing. The real story out of Victoria is, hang on, they've just basically done what China's done.
Correct.
They've just locked people in these buildings. I can't believe people aren't more angry about this. You've got thousands of people have been locked in high-rises. We went crazy when this was when this was happening in China. It's happening in Melbourne. Everyone's going, oh, yeah, well, I suppose it's happened.
But again, we haven't. But again,
has got to be held to account.
I agree, but also this was the thing: the Premier didn't turn around and say, look, this tower has this many people in it. This many of them have corona, and this many refuse to get tested. All right, so there's no the correlation. Otherwise, it's just odd. You're going, well, hang on, because a few people have it on level 3 and level 7. Everyone is locked out, as opposed to we'll test and then don't come back to the building for X number of weeks, or we'll find alternative accommodation. I mean, goodness be, it feels like the Victorian taxpayer is the one paying to fill the hotel rooms around Victoria, the idea that a healthy person who has no signs of the disease whatsoever isn't, frankly, currently watching us in Crown as in a rented hotel room, there seems to be a little disconnect here. But I'm with you, James. We'll follow that up tomorrow.